ah, I will not be able to get pregnant again, oh, because I heard that if you have fibroid, you cannot get pregnant. Is that true? A woman says, Doctor, I didn't know. I just went to the hospital for something else and they checked me and discovered that I had fibroid. How come? I want you to help us break it down. How would a woman know that I have fibroid? What would she see? What are the symptoms? Or there would be no sign at all?
Yes, that is the funny thing about fibroid. What we used to say that the commonest symptom of fibroid is no symptom at all. Like,
Hmm.
yes, more than 50% of women who have fibroid never know that they have fibroid. Never.
Hmm.
They don't know. They are just living their life, normally. And then maybe something else now happened and they went to hospital to do a checkup. So possibly they now did a scan for the woman and say, madam, you have some fibroids in your womb. Because majority of the time, fibroid they give symptom, they show body. E go just dey there.
Hmm.
Dey your own, you dey your own. That's the way it operates in
Hmm.
majority
Of
of the time, yes. But there are some symptoms that you can have when you have fibroid, which you will have to watch out for. For instance, menses is a way of where the fibroid show itself. Menstruation, when you see a change in menstruation, especially when your menses become heavier than normal. So we call that heavy menstrual bleeding. You were menstruating for 4 days before. Now you notice that you are now menstruating for 6 days. You were menstruating for someone was menstruating using 2 or 3 pads every day, but now use like 5 pads. Some women will say, I can no longer use even pad. I prefer to use pampers because it
hmm.
holds the blood, it sucks the blood more. So when you notice that, it means that there is a problem. And one of the reason for that is usually a fibroid, especially the
Okay.
fibroid that is inside the lining of the womb.
The
So
womb.
it make this person bleed excessively. Also,
Hmm.
another that's one of the common symptoms we see, or the women will come and say, my menstruation is so heavy. So when we find out, when we check, ask some questions, we now realize that she had a fibroid. Then also you can notice that your belly is getting bigger than normal, actually on the down part where we call the panus, just that part that is between the pompil umbilicus and the private part, that lower part of the womb or of the abdomen, that lower part of
Abdomen.
belly. So when you notice that that part is getting bigger, is it be like the fat there don't they big, the fat there don't they thick. So
Hmm.
you will need to touch yourself and see that a growth is growing. Before, I'm even now saying before it gets very big and obvious. But when you notice that lower part, the fat there is getting thick. The fat there is getting thick. You touch it, it's like something is there, but you can't really make something out of it. Then you need to come for checkup, and then we can help you check and discover that there is a fibroid. Those are the common one. Then later on, you now see that some women, because of the fibroid, they may be unable to achieve pregnancy. Very few of them. That's where some of them will now come for checkup and say, "Oh, there is fibroid there." But the common thing is that many women will never know that they have fibroid. But if they have to look at, they have to check their menses, they have to check their lower part of the belly. That's more like where they will find the symptoms of
The
fibroid.
symptom of fibroid. A woman says she has fibroid, or they just discovered that she has fibroid, and now she's panicking. Ah, I will not be able to get pregnant again, oh, because I heard that if you have fibroid, you cannot get pregnant. Is that true?
It's not true. Let me first just say it categorically that it's not true. Because fibroid, just like majority of people will say, they don't even know that they have fibroid until they had something else. They have
Mm.
ulcer. They now this can say they have fibroid, and this person that is telling you that has had 3 children. She has
Mm-hmm.
had
Mm-hmm.
3 children, 2 children. She didn't even know that she had a fibroid. So because fibroid dey you dey your own, most time you are unlikely to is not related to infertility. But in some cases, fibroid can make a woman not to be able to get pregnant. But majority of time, let's say Okay, I didn't even talk about a particular thing that 1 in 5 women in Africa or have fibroid. I say one in two women in Africa in Africa they have fibroid. So every but let me use a bigger way to say how common fibroid is. Then you can use
Okay.
that to specify. If there are, like I use when I'm teaching my students, if there are 10 women here or 10 girls that are
Mm-hmm.
of productive age here, about 3 to 5 will have fibroid. 10 girls
Mm.
are standing, about 3 to 5 of them have fibroids. That's how common fibroid is. But about just one person will be unable to achieve pregnancy.
Out of those people that have the fibroid.
Yeah, just one out of that 5 will be unable to achieve pregnancy because of that fibroid. So fibroid, yes, can make a woman not to achieve, but majority of time fibroid does not reduce does not make you not to get pregnant. You can get pregnant, just not too far off. The patient that I remove fibroid was even came with pregnancy. Was pregnant, and we thought that she was about to deliver. We like, why are you coming to register now? She said, it's just now I noticed that my menses have stopped. Oh, with this big belly, he don't say it's fibroid, so it's fibroid. So fibroid can be there, and the woman will still get pregnant. Why sometimes fibroid can be there and block some certain areas of the womb,
Hmm.
so preventing the woman from getting. So the ideology that if you have fibroid, you will not get pregnant is not true. It's not true.
Hmm.
But sometimes some women, because of where the location of those fibroids are, it can prevent them from getting pregnant.
A woman has fibroid, and let's say her fibroid is now very big, but for whatever reason, she's not willing to do anything at all. She says, "No, I leave it. Leave it, my body, my choice. I don't want to touch this fibroid at all. I beg." I've heard a lot. What could possibly go wrong in the long run? A woman that has fibroid, what are those things that can happen to her if she chooses to just leave that fibroid in her system?
Yeah, there are people that will advocate that if a woman has a fibroid, she should just ignore it. I'm not that advocate. Yes, there might be some gynecologists that would say that view. Let me start
Hmm.
from there so that's like a disclaimer. But I'm not that advocate because of
Okay. Why?
experiences. Now, if
Okay.
a woman has fibroid, first the woman should should evaluate the fibroid, like find out where is this fibroid, where are they located, is it disturbing me, is it changing my menses. You can't have a fibroid that is so big and is even as big as twins pregnancy, a full pregnancy. You say you want to leave it. I'm not an advocate of that. That's my. You
Hmm.
can have a fibroid and it's making you bleed excessively during your menses, because when you bleed excessively during your menses, you can faint. You are losing blood. That blood you are losing is not just only from your womb; it's from your body, and you are making your heart overwork more than normal. You can't have that and say you want to leave it or ignore it. No, I'm not an advocate of that. There are some fibroids that we can say, oh, madam, give am time or something. But when your fibroid is making you bleed excessively or is making you is very big, you can touch it on your pumpu. I'm an advocate that you should do something about it. You should try and remove that fibroid or do something about the fibroid. Don't like, oh, let me wait and wait. No, do something about it. That's my advice. Now, if you don't do something about it, what can go wrong? Fibroids, you too. They are feeding them food. And as they are feeding, when they are getting bigger, it's like a baby in the womb is getting bigger, bigger, bigger. It's feeding. And then later, because it's excessively big, you are not giving, it's not getting enough nutrient. It starts what we call degenerating, like it's breaking down, it's dying. Some of them, they are dying. Some of those big fibroids, they will start dying. And that will cause you a lot of pain. a lot of pain. Now, if they also grow very big, like we were saying that some fibroids is not like fibroid cause infertility, but depending on where the location. If they grow very big, they block your tubes where the egg is supposed to pass from. They block
Mm.
them. If they grow very big, they also block where you urinate from. That's where you see some women who have fibroid, they'll tell you they can't hold their urine again. They start running to the toilet here and every now and then. Or when they wee wee, they don't even completely wee wee they can't completely
Empty their
empty
bladder.
themselves because the fibroid to empty their bladder effectively, and that can affect your kidneys. I have seen a woman with fibroid with kidney injury because it was so big, it started compressing on her kidneys, and that affected her kidneys. You can't have a condition that is treatable and you will say, oh, leave it, is my body, my choice. No, if you first of all seek for ideas and then do something about it. For your information, what you do about fibroid is not just operation. Operation is not, it's not every fibroid will operate. There are other things we can tell you to do them. So seek help.
Seek help. Thank you. Now, a woman wants to get herself checked for whatever reason. She doesn't know she has fibroid. So, what will be the process for her coming to the hospital? What will she go through to the point of confirming that what you now have is fibroid?
Okay, she comes to